Dimapur, along with the neighbouring districts of Chumoukedima and Niuland, have been witnessing a surge in the cases of conjunctivitis. The deputy commissioners of all the three districts had ordered the closure of all schools from the 21st to 26th of August to curb the spread of this infection. I'm now being joined by Dr. Asonla at the District Hospital Dimapur. She is a senior specialist here. We are here to learn more about the nature of the infection, how it spreads, the basic precautions which people should take, and the common misconceptions surrounding it. Thank you, doctor, for joining us. Can you please, ma'am, tell us about the severity of the situation, how many cases you're getting every day, how alarming or how concerned the general public should be about this?
Thank you, EastMojo, for uh, taking for the public awareness you have come. And since the first week of July, we have been getting the cases. As the case increases uh, in our OPD, District Hospital Dimapur, I informed our hospital in charge, that is MS, and also CMO. And after discussing, we have informed the administrative authority, that is headed by our DC, Deputy Commissioner, and also we have informed our SPO, that is the State Program Officer in Directorate of Health and Family Welfare. We have informed, and accordingly, once we were getting more than 100 patients, that was the time we have informed our administrative in the department. And then, along with the school education principal director and our commissioner secretary, health and family welfare commissioner, PT, and also with the administrative, they took prompt action of closing down the school, and they took the priority, the safety for the students, and also the priority of health conscious was more. That is how the school was closed down for 1 week, and now slowly we are getting a decreased number of cases comparing to the mid of August.
Can we know how the disease, this infection, it spreads mostly among the people? Like, what are the vital, sources and the ways in which it goes from one person to the another, so that it has become this large scale by now?
Actually, the mode of spread, if we go practically and theoretically, we have exogenous, that is from outside. Exogenous means from the local spread, and from endogenous. If we just take out the point of exogenous, it is always the direct contact with the infected person, or it may be due to fomites, that is the materials or the object which has been touched by the infected person, and the uninfected person, when he goes in touch, he will get infected. So the direct contact is it is a airborne or waterborne. So airborne means even if somebody sneezes, the droplets will be there. By that also we can get a contact. By touching the object, as I said, also you can get the infection, or going very close contact with the infected patient can also cause infection. So it has been given awareness from the beginning that the direct close contact touching the materials is fomites are the main. Fomites means it's a towel, handkerchief, or any object, any material which is used by the infected person. So these are the main cause. In local cause means if there is any eye infection, from there it gets infected to the conjunctiva. That is also there. But in this scenario which we are getting now, it's because of mostly direct contact.
Can you please tell us about the types of cases and the types of infections that you are getting in Dimapur, or also the general? What are the types of infection where in which people are, affected by this conjunctivitis?
In Dimapur, in our OPT, when it starts coming, it was the acute hemorrhagic conjunctivitis. It was a type of acute hemorrhagic conjunctivitis. The patients were presenting with a red eye. Pink eye means that changes of color was a red, and it was a hemorrhagic. So, and some presentation was again with a discharge. So acute hemorrhagic conjunctivitis and with symptoms of bacterial conjunctivitis we got in the beginning, but soon we have taken the swab, and for the bacterial growth and for the uh, virus we have given the conjunctival swab, but here we could do only the bacterial part we could see. So on we have seen the 11 cases. From there it was three of them were bacterial growth was there, that is the staphylococcus, and the rest were the growth negative. So we considered as suspected as viral conjunctivitis. But now, uh, day before yesterday, also we have sent for test for the virus test, and we have sent to ICMR. ICMR means it is it is in Dibrugarh. So we have sent to, that is an Indian Council for Medical Research, and that is the apex body. So we have sent there, and we sent 13 cases. From there, 11 of them have come out to be enterovirus. So basing on that, viral infection is also there, bacterial infection is also there. We are considering as a mixed infection, but mostly viral. And we also see acute hemorrhagic conjunctivitis. We also have seen few cases of pharyngoconjunctivitis and few cases of herpes zoster, one two cases of herpes zoster. So we have seen a mixed infection of bacterial, viral. We have seen a mixed type, but mostly virus. In Nagaland, where we are seeing in this mean in our district hospital Dimapur.
So, ma'am, actually, I have talked to people, I know, and also seen in many houses by now already. A lot of the people are still not turning up to the medical facilities and doctors. People still don't know when is the exact time when they should actually approach the doctor. People are moving around with red eye, but still not. So, when should people actually come to the hospital, ma'am?
It is like we all the public knows that there is conjunctivitis outbreak is there. So if the person having some irritation in the eye or some watery, or in the morning if he has got some stickiness in the eyelid, he should search for the advice, because the symptoms start slowly. And few patients when they woke up, even the patients comes to me and say that when they woke up the eye was already red, and they can see in the mirror the eye was red like that. So any redness, any irritation, any watering from the eye, or any stickiness, uncomfortable, if you feel something in your eye, then you should seek the advice.
Now we want to know about the precautions, the general precautions that people should take so that uninfected persons don't get the infection in the first place, and also that the infected ones don't end up spreading it more among more and more people. Uh, I'm sure people are doing a lot of things wrong, so that things are spreading more and more all across the country. So, what are the basic precautions people should take, ma'am, all over, everyone?
In general, maintaining a good hygiene, that is the foremost. Washing hand frequently with the soap and using hand sanitizer. And also, uh, we have to prevent the infection from not touching the infected person, and also not touching the mobiles or the pen the infected person has used. That is how the contact will be decreased. So these are the few things. Do not share the spectacles or the eye bottle, which is eye drops vial, which is used by the infected person. We should not share with uninfected person, so that from the fingers which has been used, that can also spread. So these are one thing. And in public places or in schools, what I want to remind is that if someone in the school classroom, some children got infected. While isolating the child from the school, uh, we need the teachers also needs to give awareness to their parents that not only isolation will not do, so to see a doctor, that advice should be given. And also, this is infectious and a contagious disease, so the other siblings at home should be prevented. So that small awareness for the prevention of siblings at home, and also for the parents, that advice can be given by the teacher when they are sending isolating the child. And for common public places, better not to roam around in a very crowded places where infected persons are there, or the infection person. If you are infected, you should isolate for a few days so that you don't disseminate everywhere. So that is the advice I can give.
We want to ask you about the many misconceptions which are running around in society, uh, and also a lot of people are, you know, resorting to some form of home remedy. Some people are applying some kind of leaf uh, and juice and some other uh, not doctor recommended eye drops so that they can, heal it, and they claim to know the answer.
Lots of misconception is there, no doubt. I accept. But the thing is that once you have the symptoms and once awareness is given, to we also need to follow that. And I just wanted to mention this is that in our local paper, uh, it was that I was telling the person not to use steroid eye drops, but it came in the paper as sterile eye drops. So that also I wanted to mention that it is the steroid I said. And steroid eye drops and all, patients comes to me using steroid eye drops for 2 weeks, 1 week, and they are not healing. And I came across three patients who were using steroids. Steroid means it may be methylprednisolone, it may be dexamethasone, or it may be any other branded names. So this steroid we use in many other eye diseases, steroid eye drops, but in this infective, like if you are a bacterial having a bacterial conjunctivitis, to steroid eye drops will exacerbate the infection more. So this type of misconception, just blindly taking eye drops from a pharmacy without consultation, or what type of conjunctivitis you are presenting, you don't know, and you just ask from a shopkeeper and get one eye drops and use. And if the eye gets complicated, then it will be difficult to heal, and there is difficult to treat also. So that kind of misconception, I want the public to be aware more. Another thing is that using of herbal leaves, or say vegetables, fruits, juice in the eye. So I came across a patient who had put leaves, which is edible. Okay, then she put that juice. She made a juice and instilled in the eye, and her whole face, eyes was swollen. The redness has developed even to the neck part, and the swelling of the face was there, redness, and she could not open the eye. So I asked her to bring the leaves, and when she showed me, it was a edible leaves. And once in the flower leaves or vegetable leaves, any leaves, we consider that. Which we don't know, but any fungal infection may be there. That's why we clean the vegetables before we eat raw, or before we cook, we clean the vegetables. So this kind of directly from the garden or directly from the forest, they will pluck the leaves, and after making juice, they put instill in the eye. To there may be a again fungal infection combined with that. So this kind of thing, and I also came across a patient putting urine in the eye, and the whole face was swollen, this one also. So this kind of putting mother's milk, or say animals or human urine putting in the eye, or vegetables or herbal leaves putting in the eye, homemade remedy, this should not be done by the public. Take the advice, the nearest medical center, you can take the advice from any eye surgeon, eye or any eye ophthalmologist, they can take the advice and use the medicine. So that kind of like putting the home remedy can deteriorate the condition. And why we are more concerned, the medical health personnel are more concerned about the department is concerned, is that cornea is very delicate, and one of the eye maximum refractive power is there in the cornea, the transparent part of the eye, the cornea. It is very delicate, and it doesn't have any nerve supply, it doesn't have any blood supply, it is all nerve supply. So the we have five layers of it. The first layer, epithelial layer, if it get infected and if it responds to the drugs, it quickly heals up. But if the infection persists and it reaches the second layer, which is called Bowman's membrane, so Bowman's membrane, reaching the Bowman's membrane will lead to corneal opacity. And once it gets infected or it is destroyed, it cannot be regenerated. So this is a very important point where the corneal obesity develop means it does not regenerate, so it will lead to blindness. So we are more concerned about that. Conjunctivitis leading to infection in the cornea, which is called keratoconjunctivitis, and that keratoconjunctivitis does not heal and it persists for a long time, involving the second, third layer, leading to blindness. We are more concerned about that. So that is why we are constantly giving the awareness.
Who are the ones most vulnerable in the society? In the beginning phases, we have read in the papers and we have learned that it was students who were getting most affected. But with time, we understood that the umbrella got wider. All people from all age groups started being affected. How is the scenario like? Do we still have any vulnerability scale for any specific, demographic?
Uh, if we see now, the whole family is also infected now, though. But now also, if you ask me this question, I will say the school going children will be the most vulnerable because children cannot maintain good hygiene, and it is very difficult to let them maintain. But in adults, they can maintain. So even in present situation, when we are getting the patient where parents are involved, adults are involved, or children are involved, but still I will say vulnerability is children only.
So children should be most careful about it, or they should be more taken care of in this situation.
Parents should take care of their children because to an adult, if we advise, they know how to maintain, but it is difficult to control the children. They play together, they touch each other. So infected and infected, like 4 or 5 years, preschool students and all, we we cannot force them also. So as I said, vulnerability is more in school going children.
Now, ma'am, we want to know how the government and the whole of the state medical machinery, the whole state medical facility, is taking care of the situation. What are the steps which are being taken collectively by all the government servants and all departments, health especially, to tackle this for to stop the further spread.
As I said already, that I said that once the cases was increasing, we have informed our hospital in charge and MS and CMO for the Dimapur. We have informed the administrative authority, and we also informed our SPO, who is the state program officer. He took initiative to reach our uh, director and then PD, that is principal director, Madam Principal Director is there. Then from there again to the higher up, Commissioner Secretary is there. So it was informed, and our government, the medical ministers knows about it. He has been going to the remote districts and all, visiting and all. So the education department, the government, all initiative has taken step to curb, to prevent the spread by closing down the school. And they first give the priority that uh, the health of the student should be more emphasized on it, and they have closed down the school. That is a number one point which the government has taken a very prompt initiative step. And the secondly is that uh, once the infection was increasing, and also to the other district, when we the department comes to know, they are constantly like the advisory from the department has been issued to all the CSC, PSC, and healthcare providers. So the advisory is to differentiate the different types of clinical presentation, and also do and don'ts was all uh, out, and also the treatment part. So the advisory has been given to all the peripheral centers now. So the government take the initiative uh, in a very fast way. And the another thing is that uh, the awareness given through radios, TV, through media, different TV channels, awareness has also been given, and that is also initiated by the government only. And also the hygiene promotion awareness has been given, and environmental cleanliness, and also they are collecting the data like number of cases, and also the change of pattern demographically, or uh, the clinical presentation change of pattern. They are analyzing, collecting data analysis, collection and analysis are doing on. And a maximum part has been done by government and session only. So all the like the need, what are the strategies are needed, they are doing.
Don't forget to like, share, and subscribe to East Mojo. For any queries, put them down in the comments section below and press on the bell icon for notifications.